There are a lot of different causes of unwanted breakouts, but what if you found out your acne was actually something else entirely? Well, dermatologist Dr. Sonia Batra is here to get to the bottom of your breakout. And we know hormones, diets, and genetics can all play a role in acne, but sometimes it's just an underlying skin infection that's causing the issue in this first case.
Exactly. So basically, there are a lot of things that look like acne breakouts. This is one that you might think is a breakout, but is in fact a staph or Staph aureus bacterial infection. And nowadays, a lot of people going to the gym, which is great, but you can see here there's a little bit of a difference between this and typical breakouts. You can see the pustules, you can see the crusting. This might actually be really painful for people as well.
This is probably, you're going to take off work for this.
Is this like a barber's itch? Is this related to shaving?
It can be. It can be. So, you know, with all of the things we do to disrupt the barrier of the skin, you know, workouts, razors, sharing towels, that can create the fissures and the openings that allow the bacteria to spread. And the problem is, if you do try to treat this with acne with some of the really drying products we use, it just creates more irritation and openings for the bacteria, exactly like what you're saying.
Yeah, if you see that,
so
get to your dermatologist or doctor.
And you
because you're going to need antibiotics for that.
Exactly.
All right, this next issue, very common, a lot of redness and breakouts around the center of the face. What's going on here?
So this is rosacea, and we often think about rosacea as kind of a redness or a flushing, but people can get these very painful red inflammatory bumps as well. And the difference is this, you can see, is really central. So when we think about rosacea, we're always talking about the center of the face. Sometimes if you're thinking about more acne or hormonal breakouts, you think about the jawline, you think about the T-zone. But with rosacea, things that are clustered around the nose and the central cheeks should make you think maybe it's more of an inflammatory condition, which is what rosacea is. And so again, a lot of the treatments for acne, which might be retinoids, they might be drying, can actually make really sensitive rosacea-prone skin worse. And so in this case, you really need more of an anti-inflammatory. We also treat it with lasers, exactly, that help the redness. So definitely looks a little bit different, treated very differently.
Not everything's acne, which is what this segment is all about, because this next one you may see around your nose and mouth. And people have to really pay attention. These are subtle differences in some of these.
Absolutely, and so a lot of this is something called perioral dermatitis, which is actually a variant of rosacea, tends to occur in women, and often people will think it's either acne breakouts or they may think it's an allergic reaction and they start treating it with cortisone, which will temporarily help it, but then in the long term actually makes it much worse. People become dependent on it. And actually the treatment for perioral dermatitis is very much like rosacea. We use anti-inflammatory creams, we can use lasers as well. And I think to your point, you know, a lot of these conditions, when you're using products that are too drying and too irritating, what's happening is you're breaking down the barrier of the skin, which is its function, and that's when a lot of these inflammatory conditions can flare.
Got it.
Dr. Batra, these are all such great tips. I really think we all can learn a lot from it.